Anxiety is a common mental health condition characterized by feelings of worry, nervousness, or fear that are strong enough to interfere with one's daily activities. It's a natural response to stress, but chronic anxiety can be debilitating. Symptoms of anxiety include excessive worrying, restlessness or feeling on edge, fatigue, difficulty concentrating, irritability, muscle tension, sleep disturbances. Anxiety is a common issue, but the good news is there are solutions. Following are some solutions that will help you managing anxiety. Regular exercise. Physical activity releases endorphins, which are natural stress relievers. Aim for at least 30 minutes of moderate exercise most days of the week. Balanced diet. Eating a healthy diet rich in fruits, vegetables, whole grains, and lean proteins can support overall well-being. Avoid excessive caffeine and sugar, which can exacerbate anxiety. Adequate sleep. Ensure you get 7 to 9 hours of quality sleep per night. Establish a regular sleep routine and create a relaxing bedtime environment. Cognitive behavioral therapy. CBT helps individuals identify and challenge negative thought patterns and behaviors, replacing them with more positive ones. Mindfulness and meditation. Practices like mindfulness meditation, deep breathing exercises, and progressive muscle relaxation can help reduce anxiety by promoting relaxation and present moment awareness. Exposure therapy. This involves gradual exposure to anxiety-provoking situations to desensitize and reduce the fear response. Selective serotonin reuptake inhibitors. Commonly prescribed for anxiety, SRIs can help balance neurotransmitters in the brain. Benzocaine pines. These are fast-acting medications for acute anxiety episodes but are generally used for short-term relief due to the risk of dependence. Beta blockers. Often used to manage physical symptoms of anxiety, such as rapid heartbeat. Herbal supplements. Herbs like valerian root, chamomile, and passion flower can have calming effects. Always consult with a healthcare provider before starting any supplement. Aromatherapy. Essential oils such as lavender, bergamot, and ylang ylang can promote relaxation when used in diffusers or as part of a massage oil. Therapy and counseling. Regular sessions with a therapist can provide a space to discuss and manage anxiety. Support group. Joining a support group, either in person or online, can offer shared experiences and coping strategies from others dealing with anxiety. Family and friends. Lean on loved ones for support and open communication about your feelings. Journaling. Writing down thoughts and feelings can help process emotions and identify anxiety triggers. Hobbies and interests. Engaging in activities you enjoy can distract from anxiety and provide a sense of accomplishment. Time management. Organizing your schedule can reduce the feeling of being overwhelmed and help you manage stress better. When to seek professional help. If anxiety is significantly impacting your daily life and self-management strategies are not effective, it's important to seek professional help. A mental health professional can provide a thorough evaluation and develop a personalized treatment plan. Remember, managing anxiety is often a combination of strategies tailored to your specific needs. It's essential to be patient and persistent in finding what works best for you.